You're listening to Footscray Live.
Welcome everyone, broadcasting live from Footscray City College, you're listening to Footscray Live. My name is Marley Hawke and with me I have Luke, Grania and Archie. This is the community show and our special guest today is Nicole Byrne from Western Health Aged Care Assessment Team. Hi Nicole, welcome to the show.
That is such a cool introduction. I'm impressed. Hello.
Tell us about your work in aged care.
My work in aged care. Okay. That kind of implies that I deliver aged care to people, but I don't. I used to. I'm the manager for the Western Aged Care Assessment Service, and our role is to assess the needs of older people living in the West. We cover 5 LGAs in the Western Metro region. They're Maribyrnong, where we currently are, Hobsons Bay, Wyndham, Brimbank and Melton. Melton's an ever-expanding country, so we do have to travel far to get to people sometimes. Yeah. Do you want to know? Do you want me to expand on that?
Yeah.
Yep. Okay. So anyone can refer an older people to the aged care assessment service. Basically, very minimalistically, the criteria would be you need to be over 65, you need to be what we call frail age, so you need to have some care needs. So that's where, do we all know someone who's older who needs help from someone in the family to, myself, yeah, Archie's pointing at me. I'm not quite 65 yet, but you never know. Having said that, Archie, you make an interesting point with your finger pointing at me. I won't divulge my actual age, but I'm, well over 40. We do see people over 40, as in their 40s, in their 50s. Okay. Why do you think that might be?
Dementia? Or
that could be one thing. There's a thing called early onset dementia. That's when you've developed dementia prior to the age of 65. What other things do you think might affect younger people but older people? Depression. And how might that impact them day to day? Okay. All right. There's something else. I think, Luke, you mentioned something earlier to me, something about something that we put into ourselves that might affect our bodies.
Oh, drugs.
Yes. So we know that there are people who have had long histories of drug taking or alcohol intake, and over time as you age, that impacts you. It causes disease, which then impacts you further. And you get to a point where you're older, maybe not 65, but maybe 47, maybe 50, 55, but you actually have the needs of an older person. Yep.
Is part of the assessment that you do assessing the person's medical needs, or is it, what kind of needs are you assessing?
Yeah. So we call it care needs because it's the care that they need in order to live in the community or to live independently. So we all, we're young and fit and we feel immortal, but as we get older and our bodies break down or we get disease, that impacts our ability to do the things that we want to do or the things that we need to do. So they're very basic needs, so things like toileting, showering, eating, dressing. But then there's things like, how do you eat? How do you get your meal? Someone's got to cook it. Someone's got to go shopping. Then it's like, you can't just go to the shops and take the food. Someone's got to pay for it. So you've got to have management of finances, bills. So everything you see, everything you do is an activity. And people do things, they might need to do things to earn money. Then if they can't do things to earn money, they lose that income. So then that impacts them in other ways. So we assess care needs.
Archie here, has the number of elderly needing help increased?
Has the number of elderly needing help increased? Yes and no. The reason yes is because our population is increasing. So the more people we have, there's always going to be a proportion of that population that's older or over 65. So my understanding from a stat from 2016 is it's 15% of the Australian population is 65 and over. 15%. Wow. So it sort of sounds a lot on one hand, but not that much when you think 85% aren't. You know, that's a lot too.
So what motivated you, Nicole, to work in the field of aged care?
Oh, goodness. Well, I've always liked older people, and I've spent time over during my life trying to work out why. And I had one theory, but then I just figured, and this comes with life experience, that I am who I am. So I'm probably just one of these people that has a lot of empathy and sees need and sees pain, sees suffering and doesn't like it. And whenever I've seen older people, I can remember, I've got quite distinct, vivid memories from being a child. I've always thought, I haven't thought how horrible, I wouldn't want to be like that. I've always thought, that person needs some help. I can see they're moving slowly or they're in pain. I want to help them. They're old, they're wise, they've lived a whole life. They've seen things I haven't seen. I just was always fascinated and respectful of that older person, and I just always felt I wanted to. So I've always worked in it with older people. So when I finished uni, I'm an occupational therapist. My first job, the first job interview I went for was psychogeriatric OT, but then I got a job in aged care. So that was rehab, assessment, and acute.
So there's kind of a negative stigma around aged care, and that obviously affects the elderly people going into aged care. But does it also affect the amount of people who want to work in aged care? Because I've heard a lot of people talk about how they think it would be depressing, or they think it would be kind of a negative space, or mentally impact them to work in those environments. And do you think that stigma stops people from wanting to work in aged care?
Are you talking about aged care like providing care in a nursing home, like an aged care facility? Is that the type of care, the type of work you're talking about?
Yeah, well, any kind of aged care work that involves getting kind of personal with these people.
Yes. Okay, so service providers. All right, so you get service provision in the community, because we know a lot of older people still live at home, but they might need someone to take them to the shops to do their shopping. They get someone to take them to the doctor. Yes, some people then need someone to come in and help them shower or get out of bed in the morning. And those people who aren't safe to live at home anymore and have that help at home usually need to go into what we call an aged care facility. All right, and that's where we come in, because we do that's a Commonwealth. You get Commonwealth subsidies for that. You don't pay the full cost yourself, and that's where the aged care assessment comes in, and we'll assess your care needs and give you those approvals. But in terms of stigma, so if I was looking at a career in aged care service provision, there's a few ways of thinking about it. It depends what you want to do with older people. Firstly, I think you've got to work out what you like and what you don't like. If you are, people who pass out at the sight of blood, I don't think they're going to become nurses or doctors. If you see an older person and you don't immediately feel empathy and respect, I'd be concerned. If you see an older person and just think of them as someone who's wasting away and shouldn't be here, then I would not choose a career in aged care, because you're not going to be someone who's able to naturally feel empathy towards that person and do what needs to be done. I think there are probably a couple of things in that question that relate to the level of study that you do. So if what we call PCAs, or personal care assistants, who work in aged care facilities and help people shower and get out of chairs and walk and go have their dinner, they have a very basic level of training. So they're usually certificate courses that take maybe 6 months or a year to complete. You can build on them usually and do extra study and get more diplomas. So it depends on the ability or the, capacity you have to study and what you want to actually do. Yeah.
Just for any new listeners, you're listening to the community show on Footscray Live, and our special guest is Nicole Byrne. What motivated you, Nicole, to work in the aged care field, and how was that How has that impacted your day-to-day life?
Wow, that's a huge question. There are a number of things. So impacting my day-to-day life is I've always felt that I'm an advocate for the older person. And you see it, older people tend to recede a bit. They don't tend to be as, out there and demanding their needs be met and up in arms about things. They seem more reserved, and either because they're wiser or because they don't have the energy or they have other things to do. Yeah. So I feel like I need to be a voice for that older person. I feel like I need to be the opportunity to make that person's voice heard. And but in terms of what keeps me sort of motivated in doing what I do, I have a team of 35 staff who I highly regard and value. They're experienced clinicians and clerical support, and they're all in it for the same reason. And, what gets me up to go to work every day, because I don't see older. How did you know? Is really thinking, my staff are delivering this excellent service. There are older people out there who need to be seen and assessed. We need to help them. They need a voice. That's what gets me up.
Do elderly people have to pay for their services?
Yes.
How much?
How much? Okay, so there's a number of ways that happens. So older people usually get a pension of some sort, okay? And so the government has worked out that if, for example, say you own your own house, it depends on the service that you're paying for, okay? So if you're entering permanent aged care, you no longer have to live in your house. But if you've got an elderly spouse who co-resides in that house, or if you've got a family member or someone who's been your carer for over 2 years and that's their primary place of residence and they've been delivering care to you for 2 years, they've got an entitlement to live in that house for a continued period. So the government won't consider your house an asset to, pay for anything, but you've got to pay from the income that you earn, so your pension. So you've got to pay a certain amount, 17.5%.
Okay.
What would you say that the most rewarding part of working in aged care is?
Oh, the most rewarding part. So when I was an aged care assessor, the most rewarding part was being able to listen to that person's story, because people tell you all sorts of things. The family members say, they need this and and someone will say, I want that, and mum's entitled to this and blah. But just giving that time, letting them tell the story, and the whole time the cogs in your head are going and you're thinking of all these options and all these possibilities and what's at the core or what's causing that problem. So for me, the best part was always listening to it and then putting it back to them and saying, you've told me this, this and this. Have you thought about A, B, C? And they go, oh, I never did. And I didn't know you could do that. Or, yeah, let's do it. I thought that was the way, but yeah, let's try this. So it's just helping them understand what's a complex system and understand what the options are. And so they've got a choice and they choose their path. Yeah, so that's the most rewarding part.
So is there any advice that you give to families who have elderly grandparents or people who are struggling at the moment? Is there any advice you give them to seek help?
So when you say struggling, they're living in the community, they're struggling to what exactly? Like they don't have any services, they've never been linked in with anyone, is that what you mean?
Yeah.
What was the question again? What do you recommend?
What advice do you give to families who have elderly people who are struggling?
Okay. I would say that look, in my job we call it a duty of care because I have obligations. But as a daughter, for example, I have an elderly mother who's in care. I still have obligations to her. Just because she's in care doesn't mean I'm no longer her daughter or there are no obligations. Yeah. So it's about looking at what is going on, what has changed Is it getting worse? Is it going to get better? Do I see a need for mum or dad to be linked in with services? So for our service, aged care assessment service, there's got to be an actual need now for something.
Yeah.
Whether it's that person just wants someone to come and shower them, or, you know, they're having falls, so they need an occupational therapist to come and assess the home for safety and make recommendations on how to make it safer for that older person.
Yeah.
It might be ringing my aged care and saying, my mum needs an assessment. I don't know exactly what she needs, but this is what we're having trouble with.
Yes.
And I'd like some help. And you can ring my aged care. Hi, Archie.
Do you make the elderly coffee?
No, I don't. They make coffee for me.
Wow.
Why do you think that might be?
Because you care for them.
No. So if I've got someone with progressed Alzheimer's disease and that person's needing a lot of help and care in the home, and that person's husband's just died and he was the main carer, and they've got kids, or they might not have kids, but if they've got kids, they're at work, working, they've got their families, why do you think I might ask that older person with Alzheimer's disease to make a coffee for me?
So they feel like you're the husband of them.
No, because I'm testing to see what they can do for themselves. I'm testing when someone has to make a cup of tea, so they've got to get a kettle, they've got to recognise the object that they need, the tool, they've got to know that there's water in it or not. If there's no water in it, fill it up, turn it on, switch it off if it doesn't automatically switch off. So one of the ladies I assessed like this, the kettle never boiled because it wasn't plugged in. And she didn't realise. So her problem solving was very poor. And so everything that the family was telling me about her losing keys, locking the door, climbing through windows because she can't get into the house, was all bearing out.
Yeah.
If they can't do that, do you teach them?
Well, it depends. If someone has Alzheimer's disease, they can't learn new things because that's part of the disease process, that they're losing their memory. Yep.
The kind of passionate way that you talk about what you do and kind of the way that you care about the elderly. I volunteered in an aged care home earlier this year, and I saw that in a lot of the workers there, which was really comforting for me. Do you think that's kind of a normal thing in the industry to have lots of people like that?
I think that's a natural thing and a normal thing, and I would hope that any managers of those facilities who can identify staff that don't have that caring nature in them, or who don't do the right thing by the older person, that they are managed out, because that's not the place for people like that.
And that brings our show to an end. Thank you for joining us, Nicole. That was Nicole Byrne from Western Health Aged Care Assessment Team. My name is Marley Hawke, and I'd like to thank my panel members, Luke, Grania and Archie.
Thank you,
This
Nicole.
has been the Community Show on Footscray Live.
You're listening to Footscray Live.